In a recent speech, UK Prime Minister Rishi Sunak outlined a vision for reforming the welfare system, a vision that has stirred significant controversy and criticism, especially concerning its implications for mental health support and the broader functioning of the NHS. Sunak's proposals, which lean heavily on curtailing benefits to incentivize work, fail to address the critical gaps and ongoing crises within the UK's healthcare system, particularly post-pandemic. Here, we explore the disconnection between these policies and the real needs of those with mental health conditions, and argue for a leadership approach more attuned to the complexities of health and welfare in modern Britain. Sunak's strategy centers on ending what he refers to as the sick note culture, with plans to push those deemed able to work, including those with mental health conditions, to find employment, particularly from home. This approach not only oversimplifies the challenges faced by those with mental health conditions but also ignores the severe constraints of the current job market and the nature of these health conditions, which often hinder consistent work capability. One of the most glaring issues with this policy direction is its timing and context. The UK is still grappling with the fallout from the COVID-19 pandemic, which has exacerbated mental health issues nationwide and swelled the ranks of those needing mental health support. Children and adolescents have been particularly hard hit, with some facing waits of up to 2 years for treatment amid what has been termed a scandalous postcode lottery in service availability. The government's policy does little to address these delays or the urgent need for enhanced mental health services. Moreover, the push to reduce welfare benefits overlooks the critical role that these supports play in the lives of those with mental health conditions. Benefits are often a lifeline that allows individuals to manage their health and maintain some level of stability. Reducing this support without a robust plan to increase and improve health services seems not only counterproductive but also harmful. This is particularly evident in the wake of reports indicating that over 1 million people are waiting for mental health treatment, and the healthcare system, plagued by understaffing and underfunding, is struggling to meet these needs. Furthermore, the proposed reforms could strain emergency services even more, as individuals unable to access regular mental health care turn to hospitals and urgent care for immediate relief. This not only impacts those with mental health conditions but also overloads a system already under severe pressure from both routine and COVID-19 related healthcare demands. Critically, Sunak's approach and the rhetoric surrounding it have been met with widespread criticism from health professionals and charities. They argue that the policies could lead to worse outcomes for vulnerable populations, particularly those with complex mental health needs who are often most dependent on the welfare system. The disapproval extends to concerns that the reforms do not account for the nuanced needs of those with mental health conditions and may result in increased stigma and reduced access to necessary care. This situation highlights a broader issue with current UK leadership: a disconnect between government policies and the actual needs of the populace, especially in terms of health and welfare. The government's focus appears to be on economic metrics and cost-cutting rather than on fostering a healthy, stable society. Such a stance is particularly detrimental in a post-pandemic era, where mental health has emerged as a significant public health challenge. The evidence suggests that without a shift in leadership focus towards more compassionate and informed health and welfare policies, the UK risks exacerbating current health crises and undermining any progress made in mental health support over the past decade. Leaders must recognize and address the complex realities of health, employment, and welfare in today's society. Until we see a leadership that truly connects with and understands the needs of its people, particularly those with mental health conditions, the UK is unlikely to advance healthily or equitably as a nation. In conclusion, the path forward requires not just policy revisions but a profound reassessment of leadership priorities. The UK needs leaders who not only understand the intricate links between health and economic policies but who are also willing to invest in the nation's well-being as a fundamental priority. Only through such a comprehensive and empathetic approach can we hope to see the changes necessary to move forward healthily as a society.